The G-spot has been popularized by the lay media. Unfortunately, the popularity has reached such proportions that people really believe that such a spot is existing in a woman's genital area. The G-spot is otherwise known as Grafenberg spot, named after the German gynecologist Ernest Grafenberg, who described it first. This spot is supposed to be present 2 to 3 inches inside the woman's vagina on its top wall or the anterior wall. The belief is that when a woman is stimulated on this spot, she will get well aroused and experience intense orgasmic pressure, and some women may even ejaculate. Many women, thanks to media publicizing and popularizing it, believe this, and when they don't experience or locate the G-spot, they think something is wrong with them and they develop psychological sexual dysfunction. The G-spot has been further popularized by the landmark publication called G-spot and Other Discoveries in Human Sexuality by Ladas, Beverly Whipple, and Perry. Unfortunately or fortunately, subsequent research proved that no such spot exists in a woman's anatomy. The Journal of Sexual Medicine, which is the most important scientific journal on human sexual problems, clearly said that there is no evidence to say that G-spot exists. Further research is needed if we have to establish this spot. Radiological, that means using X-rays, ultrasound scanning, and magnetic resonance imaging, all of them could not prove the existence of G-spot. Now, what has been observed and established is the G-spot is nothing but extension of the clitoral tissue into the vagina. So, it indirectly the clitoral orgasm which the woman experiences when she is stimulated in the vagina. That this spot is situated in such a way that the male on top coital posture cannot cause friction and stimulation, the so-called G-spot. What is important is many women will reach orgasm or experience it only when their clitoris is directly stimulated, either manually or orally or through sex toys. In other words, it's nothing but a clitoral orgasm, which some women may experience during vaginal intercourse when their anterior 2/3 of that vaginal wall is somehow stimulated. What is important for us to remember is that we should not rely only on this spot. Woman's body contains many erogenous zones, erogenous spots. When any of these are stimulated, the woman can enjoy and experience good orgasms and be sexually fulfilled. Again, the ejaculation, female ejaculation, has not been proved, and somebody says it's nothing but secretions from the vagina and not ejaculation. Now again, as I mentioned, the female arousal is mostly cognitive, or that means at the level of thinking, thoughts, and feelings. Unlike a man's arousal, which is dependent on visual, physical stimuli, the woman's arousal depends upon cognitive stimuli. That means she must be comfortable and really vibing with her male partner. In other words, what is important for woman's orgasm is the quality of the relationship. So I would venture to say the R spot or R shot is more important than G spot. By R spot or R shot, I refer to the relationship aspect. So friends, please focus on the relationship rather than focusing only on the so-called G spot and getting disappointed.